Welcome to Pediatric Case Review. Today's lecture covers slipped upper femoral epiphysis, or SUFE, a common hip disorder in adolescents. We'll explore its presentation, diagnosis, management, and complications through interactive case-based scenarios. This overview is designed specifically for pediatric residents and fellows. Let's begin with a fundamental question. A 12-year-old obese male presents with hip pain. Which statement best describes slipped upper femoral epiphysis? Option A, displacement of the femoral head from the acetabulum. Option B, displacement of the femoral epiphysis relative to the metaphysis. Option C, fracture of the femoral neck. Option D, infection of the hip joint. The correct answer is B. SUFE involves displacement of the proximal femoral epiphysis relative to the metaphysis, typically in a posterior and inferior direction. This occurs through the growth plate, or physis. Unlike hip dislocation, fracture, or infection, SUFE specifically involves slippage at the growth plate during periods of rapid growth. Which patient is most likely to develop slipped upper femoral epiphysis? Option A, 5-year-old female with normal BMI. Option B, 8-year-old male with renal failure. Option C, 12-year-old obese male. Option D, 16-year-old female athlete. The correct answer is C. SUFE typically affects adolescents during periods of rapid growth, with peak incidence at ages 10 to 16 years in males and 8 to 13 years in females. Males are affected twice as often as females. Obesity is the strongest risk factor, with more than 60% of patients being above the 90th percentile for weight. Endocrine disorders like hypothyroidism and growth hormone deficiency are also risk factors. A 14-year-old with slipped upper femoral epiphysis is being evaluated. Which condition is least associated with SUFE? Option A, hypothyroidism. Option B, growth hormone therapy. Option C, type 1 diabetes mellitus. Option D, renal osteodystrophy. The correct answer is C. While type 1 diabetes has not been strongly associated with SUFE, multiple endocrine disorders increase risk, including hypothyroidism, growth hormone abnormalities, and hypogonadism. Renal osteodystrophy and chronic kidney disease also increases risk. These conditions affect bone metabolism and growth plate strength. Mechanical factors like obesity increase shear stress across the physis during periods of rapid growth. Which mechanism best explains the development of slipped upper femoral epiphysis? Option A, inflammatory destruction of the growth plate. Option B, increased shear forces across a weakened physis. Option C, direct trauma causing acute displacement. Option D, congenital malformation of the hip joint. The correct answer is B. SUFE occurs when increased shear forces act across a relatively weakened growth plate. During puberty, the physis naturally widens and becomes less resistant to shear forces. Hormonal changes during adolescence can further weaken the physis, making it more susceptible to displacement. In overweight patients, increased body weight creates greater mechanical stress on this vulnerable growth plate, leading to gradual or acute slippage. A 13-year-old presents with acute hip pain and cannot bear weight. This most likely represents which type of SUFE? Option A, stable SUFE. Option B, unstable SUFE. Option C, pre-slip SUFE. Option D, chronic SUFE. The correct answer is B. The key distinction in SUFE classification is stability. Unstable SUFE is defined by the inability to bear weight even with crutches or walkers, as in this case. Stable SUFE patients can bear weight with or without walking aids. This distinction is critical as unstable SUFE has higher complication rates, particularly avascular necrosis. SUFE is also classified by duration. Acute is less than 3 weeks of symptoms, chronic is more than 3 weeks, and acute on chronic represents an acute slip on pre-existing chronic slip. A 14-year-old obese male presents with limping for 6 weeks. Which symptom is most common in slipped upper femoral epiphysis? Option A, knee pain. Option B, groin pain. Option C, low back pain. Option D, ankle pain. The correct answer is A. Knee pain is actually the most common presenting symptom in SUFE, occurring in up to 60% of cases. This referred pain pattern occurs through the obturator nerve, which supplies both the hip and the knee. This referred pain frequently leads to delayed diagnosis as practitioners focus on the knee rather than the hip. Always examine the hip in any adolescent with knee pain, especially if they have risk factors for SUFE. Other symptoms include hip pain, groin pain, and limp, typically with insidious onset in stable cases. On examination of a suspected SUFE patient, which finding is most specific? Option A, limited internal rotation of the hip. Option B, positive straight leg raise test. Option C, knee effusion. Option D, tenderness over greater trochanter. The correct answer is A. Limited internal rotation of the hip is the most consistent and specific finding in SUFE. As the femoral head slips posteriorly and inferiorly, internal rotation becomes physically blocked. A pathognomonic finding is obligate external rotation when the hip is flexed. As you flex the affected hip, it automatically moves into external rotation. Patients also typically demonstrate an antalgic gait, decreased hip abduction, and apparent shortening of the affected limb. Which physical examination test is most useful in slipped upper femoral epiphysis? Option A, Faber or Patrick test. Option B, Trendelenburg test. Option C, Thomas test. Option D, McMurray test. The correct answer is A. The Faber test, which stands for flexion, abduction, and external rotation, is particularly useful in SUFE evaluation. It's performed by placing the foot of the affected leg on the opposite knee, creating a figure 4 position. This position elicits pain in SUFE patients. The Trendelenburg test is also valuable, often showing weakness in the affected side. A positive log roll test, where passive rotation of the extended leg causes pain, further supports the diagnosis. Always compare findings with the contralateral side. What is the first imaging study indicated for suspected slipped upper femoral epiphysis? Option A, MRI of the hip. Option B, CT scan of the hip. Option C, AP and frog leg lateral x-rays of the pelvis. Option D, ultrasound of the hip. The correct answer is C. AP and frog leg lateral radiographs of the pelvis are the first-line imaging studies for suspected SUFE. These views allow visualization of both hips for comparison and can demonstrate the posterior and inferior slip of the femoral epiphysis. On AP views, Klein's line drawn along the superior femoral neck should normally intersect the epiphysis. In SUFE, it may miss the epiphysis. The Southwick angle on lateral views measures slip severity. Always image both hips, as SUFE is bilateral in up to 40% of cases. Based on the Southwick classification, a SUFE with 35 degrees of posterior angulation is classified as which of the following? Option A, pre-slip. Option B, mild slip. Option C, moderate slip. Option D, severe slip. The correct answer is C. According to the Southwick classification, SUFE severity is graded based on the degree of posterior epiphyseal angulation on lateral radiographs. A mild slip shows less than 30 degrees of displacement. A moderate slip shows 30 to 50 degrees of displacement, and a severe slip shows greater than 50 degrees. This case falls into the moderate category at 35 degrees. This classification helps guide treatment decisions, with more severe slips often requiring more complex surgical interventions. When is MRI most indicated in the evaluation of slipped upper femoral epiphysis? Option A, for routine diagnosis of all cases. Option B, when radiographs are negative but clinical suspicion is high. Option C, only after surgical treatment. Option D, only for chronic cases. The correct answer is B. MRI is most valuable when plain radiographs are negative but clinical suspicion for SUFE remains high. MRI can detect pre-slip conditions by showing bone marrow edema and physial widening before displacement is visible on radiographs. It's also useful for assessing femoral head vascularity and detecting early avascular necrosis. CT is primarily used for pre-surgical planning in complex cases or evaluating post-treatment outcomes. However, plain radiographs remain the standard first-line imaging modality for both diagnosis and follow-up. A 12-year-old presents with hip pain and limited internal rotation. What is the least likely differential diagnosis for SUFE? Option A, leg calf Perdis disease. Option B, transient synovitis. Option C, septic arthritis. Option D, Osgood-Schlatter disease. The correct answer is D. Osgood-Schlatter disease affects the tibial tubercle at the knee, causing anterior knee pain without hip involvement. The other conditions are all important differentials for hip pain in children. Leg calf Perdis disease presents similarly with hip pain and limited motion, but typically affects younger children aged 4 to 8 years. Transient synovitis causes acute hip pain, but typically resolves quickly with conservative treatment. Septic arthritis presents with fever, severe pain, and marked limitation of all hip movements, representing a medical emergency requiring immediate treatment. A 13-year-old is diagnosed with a stable SUFE. What is the most appropriate initial management? Option A, observation and follow-up in 1 month. Option B, non-weight bearing and urgent surgical stabilization. Option C, physical therapy and gradual return to activities. Option D, traction for 2 weeks followed by casting. The correct answer is B. The standard of care for even stable SUFE is urgent surgical stabilization to prevent further slippage. The patient should be made non-weight bearing immediately using crutches. Surgery should ideally occur within 24 to 48 hours of diagnosis. Conservative management with observation or physical therapy is inadequate and allows progression of the slip. For unstable SUFE, the urgency is even greater as these patients have higher rates of avascular necrosis, particularly if surgery is delayed. Traction is rarely used in modern management except in specific circumstances. What is the gold standard surgical procedure for mild to moderate stable SUFE? Option A, open reduction and internal fixation. Option B, in situ single screw fixation. Option C, femoral neck osteotomy. Option D, hip arthroscopy with labral repair. The correct answer is B. In situ single screw fixation is the gold standard for mild to moderate stable SUFE. This procedure stabilizes the slip without attempting reduction, which could compromise the tenuous blood supply to the femoral head. A single cannulated screw is placed percutaneously under fluoroscopic guidance, positioned perpendicular to the physis and centered in the epiphysis. For severe or unstable slips, more complex procedures may be required. In situ fixation has lower complication rates than procedures attempting reduction of the slip and provides excellent long-term outcomes when performed properly. After diagnosing unilateral SUFE in a 12-year-old, what is the recommendation for the contralateral hip? Option A, routine prophylactic pinning. Option B, prophylactic pinning only with endocrine disorders. Option C, observation with regular radiographs. Option D, MRI screening every 6 months. The correct answer is C. Observation with regular radiographs is the standard approach for the contralateral hip. Bilateral SUFE occurs in 18 to 50% of cases, with higher rates in younger patients and those with endocrinopathies. While prophylactic pinning would prevent contralateral slips, it exposes patients to surgical risks without clear benefit for all. Current guidelines recommend close radiographic follow-up of the contralateral hip, with some experts advocating prophylactic fixation in high-risk patients, young age, endocrinopathies, modified Oxford Bone Age score less than 16. This remains a controversial area with practice variation. Which complication of SUFE is most associated with unstable slips? Option A, chondrolysis. Option B, avascular necrosis. Option C, hardware failure. Option D, leg length discrepancy. The correct answer is B. Avascular necrosis is the most dreaded complication of SUFE and is strongly associated with unstable slips. It occurs in 3 to 10% of stable slips, but 30 to 50% of unstable slips. Unstable slips can disrupt the blood supply to the femoral head through the posterior-superior retinacular vessels. Other significant complications include chondrolysis, rapid cartilage destruction, femoroacetabular impingement leading to early osteoarthritis, leg length discrepancy, and hardware-related complications. Early recognition and appropriate management significantly reduce complication rates. A 25-year-old with history of SUFE treated 10 years ago presents with hip pain. Most likely finding is which of the following? Option A, femoral neck stress fracture. Option B, femoroacetabular impingement. Option C, recurrent slip at the physis. Option D, osteomyelitis. The correct answer is B. Femoroacetabular impingement is the most common long-term sequela of SUFE, even after appropriate treatment. The residual deformity from the slip creates a cam-type impingement where the abnormal femoral head-neck junction impinges on the acetabular rim during hip motion. This mechanical problem leads to labral tears and early-onset osteoarthritis. Recurrent slip would not occur in a skeletally mature patient. Femoral neck stress fractures and osteomyelitis are not common sequelae. Patients with history of SUFE require long-term follow-up and may benefit from surgical correction of impingement deformity. Thank you for watching this comprehensive overview of slipped upper femoral epiphysis. Remember these key points. Always consider SUFE in adolescents with hip or knee pain, especially if obese. Limited hip internal rotation is the most specific physical finding. Early diagnosis and prompt surgical stabilization significantly improve outcomes, and long-term follow-up is essential to manage complications. Please subscribe to the Pediatric Case Review channel for more educational content, and leave any questions in the comments section below. Thank you for your attention.